right. Hi, everybody, and welcome to today's webinar on how to establish lived experience networks, councils, or committees. My name is Sandra Ferreira, and I'm the Global Manager for the Global Mental Health Care Network. I'm honored to be hosting our panel of experts today, and I'm sure today's presentations will be incredibly insightful and informative for all of you attendees. The purpose of today's webinar is to explore the significance, benefits, and methods of creating lived experience networks, committees, or councils. Establishing these groups is instrumental in bringing experts by experience to the forefront of mental health from the top down. By doing so, we can ensure that our policies, our programs, and services are truly reflective of the needs and perspectives of those they are intended to support. It's my privilege today to be joined by three of our most experienced advocates from the Global Mental Health Care Network. Each of our presenters represent a diverse perspective and set of expertise from different corners of the globe, including South Africa, Indonesia, and the United States. Before I get into it, just some general housekeeping notes. If you have any questions, and please, we do welcome questions, please keep this for the end of the webinar. You are also welcome to add them into the chat box during the presentations, and then we will get to these at the end of the presentations. All right, so to our first presenter, who needs little introduction for most of us, and is renowned as one of the most prominent and respected experts globally. Charlene Sunkel is the CEO and founder of the Global Mental Health Care Network. Charlene is a global advocate for the rights of people with mental health conditions. Her contributions extend to authoring and co-authoring numerous papers from a lived experience perspective for well-regarded international publications. Charlene has served as a commissioner on the Lancet Commission on Global Mental Health and Sustainable Development and on the Lancet Commission on the Future of Psychiatry. She has also co-chaired the Lancet Commission on Ending Stigma and Discrimination in Mental Health. Charlene lends her expertise to various international boards and committees, and previously she contributed her insights as a member of the South African Presidential Working Group on Disability and the Ministerial Advisory Committee on Mental Health. She served as a former principal coordinator for the Movement for Global Mental Health and has been recognized through national and international awards, the latest including the Swiss Foundation WHO Outstanding Achievement Award in the field of mental health, as well as the Pardes Humanitarian Prize in Mental Health, along with the WPA Presidential Commendation. Charlene, it's really a pleasure to have you here today. And at this stage, I'd like to hand over to you for your presentation, and I look forward.
Thank you so much. I almost couldn't unmute myself. Okay, so it is really wonderful to be here, and I think this topic is so important, especially as we integrate and move towards integrating lived experience across sectors, and we really see that gaining a lot of momentum. So I want to start off just to give you a bit of background how I got into the lived experience-led movement, and kind of how I started and got to establish the Global Mental Health Peer Network. Yeah, in 1991, a long time ago, when I was diagnosed with schizophrenia, and I kind of ended up and entered the mental health system. I was hospitalized. I made use of both public and private mental health services in South Africa, and that really exposed me to the mental health system, and also to show me how difficult it can be to navigate the system. So I asked a lot of questions around the relevancy of practices. So that kind of made me really determined to be involved in helping to create change within mental health. But of course, at that stage, that was what, 2003. At that stage, I wasn't quite sure exactly how to do it. Because for me, the concept of lived experience and lived experience playing an active role in creating change in mental health as partners wasn't really anything I ever heard of. So I thought, okay, so what's the biggest problem? And that was stigma. I found stigma and kind of misperceptions around mental health conditions, especially my own of schizophrenia, and how people react and how that creates barriers to opportunities. So I thought, okay, so let me go for that. And I started a publication, like a little journal. The intention of that journal was to kind of show people out there the capabilities and talents that people with mental health conditions have. Because when I was in hospital, so many of my fellow peers were so artistic, writing poetry, essays, visual arts, painting, and all that. And I thought, yes, only if the world could see that, they would realize that we are not completely useless. So I started that magazine, and that really was excellent in kind of giving that credibility to people with mental health conditions. And then someone approached me to ask me they heard my story and asked me to write a theatre play. So I wrote a theatre play on my own experiences in life with schizophrenia that is on YouTube. And later on, I kept developing more theatre plays on different mental health conditions with the intention of creating understanding of the real life experiences and realities of people with mental health conditions, and also to give a perspective of the system. That kind of gave me credibility, and I was offered a position at a provincially based mental health organization where I helped to establish a service user movement for the province. Um, and for me, the model I used was empowerment first. The reason for that was I found that a lot of my peers were so disempowered either by the system or stigma and discrimination, lack of information, that it was important to really empower people first before you can really get them involved in advocacy work and changing the system. So that's what I did. It was actually very successful. And then I moved on 8 years later to a national organization where I managed that South African mental health service user movement and implementing the same kind of concept or model of empowerment first. Now, what's important to know here is that both these provincial and national service user movements were part of an organization that provided services, a non-profit organization, meaning it was a project. So it wasn't an independent lived experience organization. So for me, I had a bit difficulty with that concept because, again, what does it say? It says like we cannot function independently as a lived experience organization. So by that time, it was already in my mind. And adding to that, I was also getting quite increasingly involved in international work and also speaking to a lot of people with mental health conditions from across the world, especially low and middle income countries. And then came up with the idea of really establishing a global lived experience movement or organization to really make a bigger change globally. And again, for me, the importance was it must be an independent organization for and completely led by people with lived experience. So that is where the Global Mental Health Peer Network came and was launched in 2018. Whoop. Okay, so for me, there was problems that I encountered in South Africa and sometimes also in some places where I came to learn about lived experience movements. Although it's gained a lot of momentum, there were still problems. And for me, these three aspects were really barriers of integrating people with lived experience and enabling them to become independent as experts in their own right. First of all, paternalism. Paternalism is often, or in most cases, with good intentions. But it's still making decisions for people. What to say, I had several incidents where, although we were a service user movement, we were still told what to say, what to do, and also sometimes insisted on us having a support person to support us, even though we didn't need it. So that paternalism was a barrier for me. And then tokenism, I suppose to some degree, you still find that all over the world. But in the context of South Africa where I was involved, I found that people with lived experience were often randomly selected to be involved, whether it's like policy or reviewing laws, just randomly choosing someone to give input, just to say we included people with lived experience. But there were no measures put in place to ensure meaningful and authentic inclusion. And both paternalism and tokenism is very disempowering. So for me, the system wasn't suitable to really integrate lived experience. And there wasn't an understanding of how to create a safe and engaging space for people with lived experience to be key partners. So just to give you steps, this is kind of to learn, or maybe how you can learn from our experience, how we were established and how we went through different processes. It takes a lot of patience to start a formal organization like the Global Mental Health Peer Network. I think first it's always important to define your vision and objectives. So why do you want to exist? And what do you want to achieve by existing? And of course, how do you want to do it? How do you want to achieve that? And then the next step was to come up with a name for the organization. You need that identity. By that, looking at different keywords that represent your core function, that can create a name that stands out. And sometimes it's good if you can choose a name that can be uniquely abbreviated. And of course, more importantly, not to use a name that's already used by someone else or another organization, and then to design a logo. By that, you have your identity. And then to look at creating your operational structure. What always is helpful if you create an organogram or flowchart of how you will operate, who's responsible for what, and also to develop a business plan and operational budget. It's always good to have a comprehensive business plan and budget, and then a shorter vision. People who you may approach for funding don't necessarily have time to read a very lengthy document, so it's always good to have a short version. And then launch the organization. I know it's a bit different other ways around. Sometimes you would think you launch it after you've done all the processes and formally established. But launching the organization, you can still launch it without having all the registration process completed, because you've got what you want to do, your name, everything, and you can really build your brand around that. And then all the statutory processes, which is sometimes lengthy. In South Africa, we have a NPO Act. So these processes need to follow that. And usually the first thing you do is to appoint a board of management. And then you draft your constitution to lay out exactly how you will operate and all the governance structures within the organization. And also a charter is also important to kind of lay out what you stand for. And then to register the non-profit organization through a government authority in South Africa, it's our Department of Social Development, who has a unit where you register an organization. For us, it's free. I know some countries, they actually charge for that registration. And then you can open a bank account, and that we always need a board resolution to open accounts and to assign signatories to that bank account. And then your tax, we registered as a public benefit organization with the South African Revenue Services. And then you're ready to go to secure funding and reach out to donors and apply for grant applications. And of course, you also can kind of generate donations through crowdfunding or other means. That is kind of the process. And I think this entire process took about a year. to complete to where we got funding and started operations. So key points that I've learned and that I would like to share is it's always important and it's very helpful for an organization to have the strength whether it's able to adapt in a changing environment. Because as you know, mental health and some fields really change quite a lot. And that is built on resilience, cultural competence, continuous learning, innovative thinking, and also the ability to integrate new research and technologies. So when you start, it's always good that you do an assessment of the landscape. So what exists, where the gaps, and if whatever exists, how can you collaborate with that? It's never good to reinvent the wheel. Sometimes that can often cause like organizations working in silos and not really working together towards common goals. Networking is very valuable. And when you get them, establish contacts, talk about your organization, the concept, what you do, and you can present your business plan. And of course, always back your concept with evidence and lived experiences at grassroots level. Then you can also look at donors and how your organization fits into funding strategies. Then promotion, you can build your brand. There are cost-effective ways you can do that without paying initially. I mean, social media is free. You can already start your social media pages. Sometimes you do get sites that offer free websites. Unfortunately, it got their domain name attached to yours, but you can always change that later. It's important to become visible. Professional conduct, you need to build that respect and trust with people and stakeholders. So you always need to exhibit transparency and that you're really determined and willing to learn and to share your knowledge. And to build that good reputation is always important for success. And then build up knowledge. It's always important, especially I think in our field, keep up to date with research, read a lot, ask questions. No questions are stupid, always ask questions. I remember I used to ask a lot of questions and I still do ask questions because you need to understand the landscape and discover diverse perspectives, especially when you're like a global organization or working with global populations. It's important to understand the different perspectives of people and the different needs. And to keep up to date with latest development and trends is also good. And that will help you to optimize the relevance of your organization. I'm not going to go into much of this because I'm sure my colleagues after me will go into more depth. The other component that we also speak about is establishing a lived experience council or committee. So these are just some of the important steps to also consider when you do that. First of all, to define your objectives and scope, to really look at the purpose, goals, and scope of the committee. And then to recruit your members, so you can have a recruitment strategy. You can do that through application, or you can reach out to networks and other community organizations, social media, to get people to join. And then to establish a governance structure. What's always used in councils and committees are terms of reference, but it's important that you do that with the members that you've recruited or appointed to the committee, that you together develop that terms of reference. And training and support, for example, you can have like an orientation session that we often have, for example, with our own members in our committees, is so that everybody's on the same page. This is a platform where you can ask questions. That is where they can understand their role and what's expected of them more clearly. Other ideas is also to provide ongoing support, and that includes mentorship to help the committee's work. Then facilitate meaningful participation, set up communication channels, like you can do WhatsApp groups, via email, and then develop a work plan. And that again, you do together about the committee's priorities, activities, and timelines, and evaluate and adapt. So you always learn. For example, your terms of reference is also a living document. It will change, especially when your council or your committee is new. It will change as you figure out how things work best. And then that evaluation and feedback from members is very important to make sure that you maximize the functioning of the committee or council. And then sustainability, to develop strategies to sustain the committee's work over a long term. And that includes securing funding and resources, and to foster a culture of continuous improvement and adaptability. And that is all from me. I don't know, I hope I didn't carry on for too long, but thank you so much. And I'll hand over back to Sandra.
Thanks, Charlene. I don't think you carried on too long. I think we could listen to you for many more hours, that's for sure. Your experience and expertise definitely comes through, and it doesn't matter how many times I've heard the start of your story, I'm always left in awe. And I think a lot of the people on this call as well would feel the same. So thank you for your hard work and dedication and for taking the time to put your presentation together today. So thank you. Right, we're going to move on to our second speaker of the day. I'm very pleased to introduce Laura van Tosh, who is based in Washington, D.C. Laura is a peer who has held policy positions at the National Association of State Mental Health Program Directors, University of Maryland, and the State of Oregon Health Authority. She is the founder of the Mental Health Policy Roundtable that met in Washington, D.C., and she started a local version of the Policy Roundtable in King County. The Roundtable brings newcomers and veterans of policy together in a neutral environment of learning. It celebrated 25 years in 2023. Laura has written extensively about peer-operated behavioral healthcare services and homelessness, and has worked inside 3 state psychiatric hospitals. Her work is born from experience as a patient turned activist, and she has been involved with the peer movement since 1985. In December 2021, Laura was appointed to the Global Mental Health Peer Network as Country Executive Committee member representing the United States. She has since been named a member of the GMHPN Alumni Group and is currently a mentor. In 2024, Laura was invited to serve as a member of the GMHPN Board of Management. Laura has been recognized for her work in behavioral healthcare field over many years, and in 2022, she was awarded a Lifetime Advocacy Award from Judge David L. Bazaloon Center, for Mental Health Law. In 2023, Laura was presented with the Sally Zinman Lifetime Achievement Award from the Alliance for Rights and Recovery for her leadership in advancing the recovery and rights of people with mental health and trauma-related challenges across the nation. Laura also serves as a consultant with Meadows Mental Health Policy Institute. Laura, it is my pleasure to host you, and I really thank you for joining us and taking the time out this morning. As your bio illustrates, you have been a mental health advocate for many years. Can you tell us how your advocacy began?
Absolutely. First, I want to thank very much the Global Mental Health Peer Network and Charlene, especially, and all the staff. This has been a reawakening of my advocacy now in the global sphere, really reminding me of why I got involved in all of this. And what impact being involved has really continued to support me in my own recovery, which I think is probably one of the most important things that I've done in my life, is to kind of turn lemons into lemonade and find ways that I can give back. And I hope for you all, welcome everybody for attending, that you'll find that also a part of your lives as you start moving on the road to recovery and getting more involved with councils and committees. I became involved in the late 1970s when I was, hospitalized. I was 17 at the time and really uncertain about why I became ill, what challenges were in front of me at that time. And so I was institutionalized for a fairly long period of time. And then I was able to get out of that experience and was, within a couple of years, I was actually back back in the hospital, excuse me. Unfortunately, I had a relapse and ended up in a state institution at the age of 19. And it was really there that I began to see some of the challenges that we all faced being institutionalized. I was watching other people be treated unkindly and inappropriately, and maybe not even provided any care whatsoever within this kind of difficult environment in the state institution. And I decided that I wanted to do something about it, and that I swore to myself if I got out of the hospital, which was kind of a concern to me. I didn't know if I'd ever be discharged, that I would choose to do something about what I witnessed and what I also experienced as a patient. And so it took me a while after I got out of the hospital to get myself ready to do that. But I did discover that there were resources that were just starting to appear in the environment. There weren't a lot of resources for peers back then, but I found some preliminary work being done at the national level, and then also within my own community. I ended up joining peer support groups and really becoming engaged with other people like myself to try and make changes in the behavioral healthcare system. I was also working at the time, and there weren't any jobs like we have today for peers. There weren't peer specialists. There weren't even anything like the Global Mental Health Peer Network, at least nothing that I had heard of. And certainly nothing at a statewide level, which is, I was living in a community that relied on state organizing. And so slowly but surely, I started recognizing that these services could be created. And I joined a board of directors for a family organization, so became more involved at that level. And that really helped me to start seeing where I could plug in and begin to make some changes as an advocate. I didn't know exactly what advocacy meant, but I knew that if we banded together, that we could make change. The other thing was I eventually got a job in the field, and it was a peer-run street outreach program for people who are homeless. And advocacy was part of the title of the program. It was called Outreach, Advocacy, and Training Services for people who were homeless and mentally disabled, also known as Project Oaths, like the cereal. And so advocacy was a big part of that project. And there I was about 25 when I got that particular job. I moved to Philadelphia to take up with that position, and networked with a lot of people in the city of Philadelphia who were actually homeless and mentally disabled. And it was through that initial work as being an advocate and seeking out other people's perspectives that we were able to create new programs that were peer-led. And that advocacy, if you will, was really, activated by getting out in the field and talking with people and doing street outreach, networking with other people as well. So that's a little bit of a long answer as to sort of how and why I got involved. But it's so important to kind of remember kind of why you got involved. And I think by preparing for this workshop, I was able to get back in touch with that spirit that I had, which was kind of naive, but it was also, a clean slate that I could come back and do something good for my own community. So.
Excellent. Thanks, Laura. I just want to double check, is my audio okay?
Yes, I can hear you. Yes.
Thank you. Thanks. Yeah, I mean, you've been in the field longer than I've been alive. And it's it's testament to all your hard work. And I'm sure looking back, it does bring in, like you say, that essence, that free spirit, that naivety of your initial advocacy. But at the same time, you have most definitely made strides for many of us, not just locally, but internationally. On that, what advice would you give someone who is starting on their mental health advocacy journey and looking to create advocacy councils or committees?
Absolutely. Well, specifically and also thinking back at what worked for me, and what in some lessons that were learned along the way, is really to be willing, and I think Charlene kind of touched on this as well, is to be willing to make changes along the way, that when something is created, there may need to be a reassessment of what's happening, and if your particular agenda is something that'll be effective over time, and being willing to make modifications if you believe that changes do need to be made, which often is the case. It's different than a recipe for baking a cake. In this case, it's a recipe of actually adding things that you would never dream were important. The things that worked for me during this period of time is to start small. I've had a lot of great big ideas that were manageable, but they were difficult to kind of implement and maintain over time. And I think what helped would be to go back and reassess my original goal and take kind of small bites out of your particular agenda that you want to create. Starting small is really important, I think. Collaborating with others. I know in my advocacy work, especially in Philadelphia, when I first started working on the peer run program, it made a huge difference to collaborate with other people that had not only created programs like what I was trying to do, but also who are knowledgeable in the system of care, that carried a whole lot more kind of historical awareness and underpinnings around how the system functions. And collaborating with others in that respect is crucial. I came into a city, the city of Philadelphia. People used to call it the state of Philadelphia because it actually commands almost all of the resources at the state level. But the city of Philadelphia is complicated with many different kinds of stakeholders and agendas. And so it's very difficult for me to just jump right in and know what I was doing and who to talk to and how to get things accomplished. It took time for me to identify other people to collaborate with. And those relationships were crucial to the success of the program that I was starting. Knowing the history and understanding this history of where you're working is also really important, kind of emphasizing that with the work that I did in Philadelphia to get to know the players, the historical issues, and all of that is doing my homework. And I also recommend that as a really specific thing to focus on. We can't make assumptions about the way things are when we're preparing our advocacy journeys. We have to be very flexible. And I think also doing your homework is really important with regards to identifying who to work with, but also, some of the rationale for your advocacy ideas of creating some plans similar to what Charlene was laying out in her slides. Being able to create plans and make changes over time. Talking with others and communicating with others, another item that Charlene mentioned. Having monthly meetings with stakeholder groups and other organizations that might be interested in working with you. I'm kind of focusing on a peer-run program that I led in Philadelphia, but you can apply much of what I'm talking about to creating an advisory council or a committee. And a lot of what I did was to create avenues for my communication to have success. And that included creating regular council or committee meetings with stakeholders and other people involved in the system. Maintaining flexibility is really important. I operated with a grant, which required me to do certain things, but there were times when we needed to submit changes to our grant, our funding source, and give reasons for why we were making those changes. And it was really important to be able to maintain flexibility so that our program could be shifted in a way to make sure that we were having an actual impact. And then finally, this is probably the most important thing, is to think about how representation matters. And what I mean by that is the work that we were doing really cut across Indigenous groups and people that are BIPOC, as we call in the United States. And really, I had to focus on making sure that the people involved in the project, which again created opportunities for committees, were reflective of the population that we were serving. So our program and many others in Philadelphia at the time were focused on people of color and making sure that we were providing services and opportunities to come off the streets and end their time being homeless. And so we had to make sure that we were hiring people that were reflective of the population that we were serving. So the staff that I brought together were actually mostly people of color, because that was really the people of color that we were serving within our program. And this really applies, and would encourage you to really be sure you do that when you're creating councils or committees. It's making sure that you have representation that reflects the population that you want to impact. And then focus on the tokenism issue, which Charlene mentioned as well, and making sure that you're not just asking one person to serve, to represent kind of global groups of people, but make sure that you include other people besides one or two people. So that kind of covers that next question, Sandra.
Thanks, Laura. There's definitely some gems in there. I love the cake analogy. I think I might take that one, where it's not the ingredients. You'll throw jelly tarts in the cake at some point. So there's really some really deep knowledge and insight there. So thank you. I'm hoping you'll get some questions on that as well. And both you and Charlene have spoken about adaptability and flexibility. It's coming through quite strongly. And I think it's so very important. As you say, things change, and we need to move with the change as well and not remain stagnant. I think that's very important points to note. Briefly, Laura, if you can just, as a last point, how has advocacy changed over the years, and what impact does it have on mental health policies and legislature?
Okay. Well, advocacy in our environment, which are the environment of the peer, the peer population that we're all part of, has really shifted over the decades. Now, very early on, I've written about the history of the peer movement, which really goes back to the early 1900s, with the founder of the Mental Health Association and other leaders of that time. They were just beginning to see what the opportunities were back then. And then over the decades, which is really a long period of time, we've had leaders and kind of philosophies that have merged with the peer movement, that have moved us forward in huge, kind of countless ways, that it's very difficult in one webinar to cover everything. But I do want to say that all of the work that we are doing today is actually changing the system dramatically. The role of peers as workers in the field themselves has really changed the system dramatically, that we now consider a peer workforce as being something that we need to have in all of our behavioral health structures at the state and local level, and even, and again, internationally and other way, globally. And I was just at a meeting yesterday that involved looking at the national workforce challenges that we have, especially since COVID. And I was so happy to see, without doing any advocacy whatsoever, that this national body that created this workshop included the voices of peers in many ways across the period of this 2-day conference, but also the work that we're doing and accomplishing, and that we are on equal footing with many of the other roles in the behavioral healthcare world. In other words, we're on par with social work, we're on par with nursing assistants and other positions that are in the workforce. And I sat back and I just was really hugely impacted by the growth that we have experienced. And I was so proud in a way of being part of a movement that has been carrying us along for me 4 decades. And so there are other people that have been involved even longer than I have. But to watch these decades roll on with the changes that we've been able to experience is something to celebrate and be really proud of. Another thing that's kind of changing the way our sort of policies and opportunities are, the impact that advocacy has had over the years is coalition building is much more common right now. Being a peer in a peer organization and being able to build coalitions with other entities is really crucial to getting things accomplished. We're looking at ways that we can change the way mental health benefits are created and financed. And all of that is being done in coalition with other national and international organizations to move coverage to a better place for all of us. Developing petitions and other kinds of even legal briefs where people come together and write, I forget how to pronounce the term, but it's a term where you're a friend of the court and you write position statements that go along with legal decision making. And that also is being done with a lot of people working together to accomplish that. I think also recognizing that advocacy, even though we've accomplished a lot in 40 or 50 years, that it's still incremental, that advocacy actually still takes that time, one foot in front of the other, one support group in front of another, and one kind of systems change that peers can say that we've accomplished is really one step in front of the other. And that we need to recognize that advocacy still is a slow process, even if we have made some huge strides over the course of these decades. And I think the last one, which is probably an area that I could use more help with, is communication. It's much easier now through the opportunities with social media, which I'm learning myself at this point. Communication is a lot easier to organize groups and other issues than it ever was over the last at least 30 years or so. And so that's provided an opportunity to open up doors to work together and to make changes just even through the course of Facebook, and making a single post about an issue can really create change in our system thanks to the advent of social media. That kind of concludes my remarks on these 3 questions. And I want to thank Sandra and my 2 fellow panelists for helping me to think about these issues and to play a role in this particular webinar. Thank you.
Laura, you've been absolutely wonderful, and I think your passion and your dedication really comes through. So thank you so much for all the thoughts and a heartfelt thought at the end of the day that you put into your presentation. Okay, I'm sure again, yes, hopefully we'll have some questions for you at the end of the presentation. All right. Last but not least, I'm delighted to introduce to you Agus Sugianto, affectionately known as Antu, who has been a mental health advocate since 2010. As a dedicated human rights and global mental health activist, Antu connected to various mental health groups in Indonesia. He also managed and organized numerous support groups across Indonesia and played an instrumental role in collaborations with the Ministry of Health. He actively joined policymakers and has been a vocal advocate on the international stage. Currently, Antu is also pursuing a PhD in mental health at the University of Manchester in the United Kingdom. His academic endeavors are complemented by his active role as a board member of the Global Mental Health Care Network. It's my pleasure to now hand over to Antu for your presentation. Thank you, Antu.
Yep, thank you. Thank you, everyone. So it's an honor to join with this amazing panelists like Charlene and Laura, which our new director of board member of Global Mental Health Peer Network. So actually, I will present about the how established the network or community group, we can call it support group in low middle income country, which as we all know, there'll be very limited resources and funding. So could be the most challenging aspect of building the network. So as Sandra already mentioned, I was joining the advocacy work since around 2010, which at the first I was joining a local peer support group in Indonesia that was not really established, but now we are establishing. So then I will explain and telling a story about how we end up into this level advocacy and back then how it was started. So, but the crucial aspect of establishing a network or peer support group or community or lived experience organization is the recovery itself, the sense of recovery and the condition of recovery of us or people that going to establish the group. Recovery can be a very long journey, so it's going to be ups and downs. It's to make sure that we are in stable condition, then we organize and manage it. So finding local support if it's not there yet, so we can build a small one. So by actively engage, so that our experience can be understood, so then we can also acknowledge the challenges and also finding what's the best way to make this group established. Whereas Charlene and Laura telling a story about or how to technically build the group that, so I'm telling the experience of how it's you know, it's not technically, it was like by nature and we gather by our intentions of because of the same value that we had at the time. As I remember, we were gathered because we had the same struggling with, of course, the enormous stigma about the difficulty of this passion and family, how to achieve the recovery. It can be start from that reason, why we established a group. So with the goal of raising the awarenesses of our local community, we can start in small, like Laura already mentioned, start small by just small gathering. We remember our community in Indonesia were just starting for a local Facebook. I will tell about that later. So the value that communality that we had is like ensuring the people who are joining and willing to join is at the same page, which means usually the value that going to last forever, like the compassion, the same respect, and the needs to help others. I think that what makes it going to be happen. So it's never just one man show. It's not about someone or a person who wants to stand out in among others, but it's about how to build this together. So that's what the value, how a community can be established. So as an example, our community in Indonesia with 200 and around 80 million people in Indonesia with a lack of mental health services. People are not accessing the service as the what research say, 90% of people in the low middle income country do not or unable to access the mental health services because of the stigma, because of the services not available, because of a lot of various reasons. So it was our founder is Mr. Bagus Utomo, which is I'm not the founder, but I'm part of the group. So he established it starting from a Facebook community group. It was an open, we made it open, not private, because we want to also educate people. So this is something that really feasible that we can do in our area, where the most crucial challenge is the funding. Nobody's going to care about this, so we can start from what we had. So at that time, in around 2005, 2006, that it established this group, and it was a few member from few people. Then it's growing, become like almost 90,000 people from around Indonesia, and we now established. So this group is act as a support group. So people are interacting and commenting and explaining their story, and there are a lot of safeguarding in this group. Like nobody going to judge anyone. So if someone insulting or judging, then the admin, I'm part of the admin group. Like we remove these people, and we ban the people who insulting other and degrading others. So this is really feasible that we can do. It doesn't have to be the formal one. It can follow up the formal one, like establishing the network, like what Charlene stated, like establishing illegally, formally, and making everything. So that's another level of that we can achieve. But for as a starter, it can start small. And now we have also WhatsApp group in each province that already established our organization, where the member mostly are lived experience and the family. And as a result, internationally, we have a lot of collaboration with Mother Hope Indonesia. I think Yana here is part of our connections. So we have a lot of campaign together through the webinar, through the help. Sometimes we help each other about Facebook posts that a mother, for example, experiencing depression. They post in our Facebook KPSI. We call it KPSI, and Yana also commenting on that group and helping this mother, for example, and it's also happens across us supporting other. And also we have collaboration as well with Amber Mental Health. I think Global Mental Health Peer Network also has this collaboration, and various organization, university, research project, and everything. So, but to achieve this kind of level establishment, it took a long time. It took for us, it took about more than almost 20 years, 15 years or so. So this is the location where because Indonesia is like the archipelago, there are a lot of islands. So mostly it's centralized in this capital city. I mean, it's the Java Island, which is where a lot of service available. But we are now trying to encourage people to build their own local support group that start from small. So the role of this peer support group we are doing, at first, it's just about like supporting others and providing a good information, adequate treatment, what to do if the patient got relapse, or what to do, how to deal the stigma, because people are really previously, before to joining the group, they have a lot of burden of a shame in the society. But where people are joining this peer support group, they feel like they have a sense of belonging, that they are part of there are some fellowship, like the friendship that grow, that finally we educate people by everything, by any means, like we can gather about from the material, and doing workshop, seminar, or attending the training and everything. Of course, the main challenges will be engaging the stakeholder, but we are lucky to have many professional mental health that we reach out then, and they care enough. So because we are about raising the awareness, we want to campaign to the society. So eventually the government, not always, but some of the government in Ministry of Health, they care about this, and they reach out to us, and also some professional, mental health professional, which is psychiatrists and psychologists, are able to join our group WhatsApp, for example, and also join the movement. So we are able to making connection. I think that's how it starts, and over and over. Sometimes at the beginning, even this professional initiate and encourage people together, because when they making the program that connected or part of the hospital program, people are not eagerly want to join because of the stigma of the hospital and everything. But since we are doing it in really local, like coffee shop or just like a public park, we are doing it really in the capital of Indonesia, Jakarta. At the first time, our community group was start from the gathering in the public park, that we just doing the like small picnic and we are sharing each other like that. So it could be very just practical things. So because yeah, being flexible is very important and persistent, because that's the persistence and flexibility, and also the sharing the feeling of we need this because we want to help others, and because the stigma is very high in the society. That's why we need to gather all of the energy and power to deal with. So but collaboration is very important, and integrations if it's possible, because not always work, because integration, for example, in the government body is very hard because have their own interests. But eventually, me and Yana here always discussing like lived experience organization or people who establish this peer support group always stays forever, whereas the government that going to sometimes involve, they're going to change because of the political situation, because of the position, because of the work 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 time, because as a part of the government they can be replaced anytime. So that's also a problem, but we have to stay. That's why we need to educate ourselves, and for example, finally developing the strategy. And because we're not going to be very just naive, just become a really not uneducated or a small group. So we need to develop that by the time when I think every country have their health campaign, so we can reach out, or either they reach out to us if we already established. So that's what happened in, and so that we can do a lot of involved in the policy changes. One time, in the year of 2012, I think, a lot of people in our NGO coming to the parliament, and we are talking that we need a lot of changes. For example, there were the medication for people with mental illness not covered by the health insurance, for example. Then we fight for that, and finally, we making changes. Like now, the medication for the people with mental health conditions, it's covered by the national health insurance. So this is a high uh, achievement for us. But of course, we need more than this. Like we need to be there be stigma reduction and everything. That we need to save lives, because people need this, because a lot of people end up being chained and died in the chaining. That's really concerning in the human rights anyway. So that is what how important of the establishing network, because we are never going to be able to just move in one person who's going to do everything. No, it's not going to happen. So my message will be like use what available in our area, especially in the low middle income country, or people in the area that where there is no peer support group or support group or anything. Just from this small peer support group, it can grow for an established organization, just what we have now. And as an example, now I'm also live experience, and you also experiencing starting from the zero of establishing organization. Now I'm part of global mental health peer network. So this is never going to happen if I wasn't joining this local small peer support group that I had in the past. And I think what important as well is a strong sense of belonging, because yeah, there are a lot of type of people who join in the peer support group with their own intention and goals, but it's all right. I think through time you will find people who really has this altruism feeling that they want to nurture this group one, because they want to find the meaning of their own life to help others. So I think we will find those people always in anywhere. So effectively, it will empower, because we need to educate also, learn from each other. Since learning about advocacy, for example, that is really crucial. And advocacy training is needed. Finally, yeah, now there are a lot of NGO that we can collaborate to, and be strategic, adaptive, flexible, persistent, of course, and also we have to really care about how to make this small organization or any establishing network that lived experience should be sustained. So as what we all know, finally, maybe building a small business unit that can operate and funding itself, because okay, at the first time we were going to rely on some donation or on international grant and everything, but it won't last forever. I think the best way to establish this organization is they going to self-independence and self-sufficient. But that's still our goal to reach. So I think that is all my presentation. Thank you very much. I hope it can add to our conversation. Thank you, Sandra. I give it back to you.
Thanks so much, Antu. And yes, definitely, obviously, it does add to the conversation. Very much appreciate all the thought you put into it. I think some of the things I can pick out from your presentation is it is as simple in theory to start small. Look local, look at your local context and create small peer support groups if you're looking just to create a lived experience group. And your group is evidence of the power that it does hold. And you've seen some changes. Obviously, that would be great, like you say, with stigma and discrimination to address that a bit more actively in certain instances. But this is the place to start. So thank you, Antu, and thank you for your lovely presentation. And then obviously to the other two advocates as well, Charlene and Laura. I do want to open the floor. I know we've gone over the hour slightly, but I do want to open the floor to any questions anyone may have. So at this juncture, if there is anyone who'd like to ask a question, make a comment, you're welcome to put up your hand. And then from there, we can take your questions. Or comments.
Well, if
Okay,
it's
well,
okay, I just want to, I'm curious, is anybody starting an advocacy project, or are you involved with something right now that you are working on that you may want to share?
Okay, I would like to share some of our NGO in Indonesia is doing now. We are asking to collaborate with our Ministry of Health to establish a small community project. Like this goal of this project is like deinstitutionalization and also community based on rehabilitations. So this is a small project. I think this project was initiated by WHO Southeast Asia. So our government reached out to us to help to, yeah, because the challenge is if the government or hospital are doing it, building a community network, it's not easy. I would say it's impossible. You do it from the health official. So this is not going to work. And we advocate to the government. And yeah, now because we are now really campaigning about the lived experience involvement in everything, our government also recognized that throughout these 5 years. So I was invited too. So I voiced this information like, no, you will not going to able to do it unless you involve the lived experience, this is true because they tried to do it and not really working now. As a result, because this is going to be done in the really remote area. So the government minister of right now, I think at this moment, 2 of our members were with the team of Ministry of Health coming to this remote area, trying to establish the network. So this is what I can share. So this is a long journey of making the stakeholder involvement. Like we try to reach out and they try to reach out too. So I think I hope the collaboration could go a long way in the future. So that's what I can share a bit. Thank you.
Thanks so much, Antu, and thanks, Laura. I see we do have some hands. I'm going to go to Julie first. Julie, if you can ask your question or make your comment, please.
So I'm learning so much. And my project is not trying to start a new thing. I work at a hospital through a program that just is a few years out of pilot project, where they have us peers working in the hospital alongside a multidisciplinary team of doctors, midwives, nurses, and they truly value the peer contribution. However, they keep us at pretty low at, the bottom of the totem pole, and kind of work us like dogs and expect if we didn't have any confidence in what we did, they would pretty much think that we were supposed to do their bidding for them and expect us to guide their patients into what services they think the patients are supposed to be doing. And I have been working really hard at trying to get a peer supervision, get a peer in leadership roles, so that the peer voice can be, at a level where the peer experience can be the lived experience, and what a peer really is there for can be at a level that is more respected, I guess. And so I really appreciate this information. And I'm working with HealthShare in Oregon to get a peer in a leadership position to really be able to show what peers are really actually doing and what we're here for. And to get it to be a more person-centered approach, because I'm seeing that there's this the superiority of Western medicine expectation for peers to push people into what is expected from doctors. And it's really concerning to me, because I see that there's people that feel like I can see these patients like know better about their own bodies, and they're being treated kind of like lab rats, especially in the fentanyl epidemic. And I just could use some guidance, because people are starting to listen to me and they don't know what they're doing, including peers into this environment. And if I had the right guidance, I feel like they would listen to me better. So I'm glad to be here. And I want to connect to you, Laura, because I have their attention. I just need to be able to present them with correct information so that they'll listen, because we need peers in leadership roles at HealthShare and in the insurance companies everywhere. We need to have them understand what peers are really here for and what we're doing, and have them accept our expertise in this field.
I gave you my email, so feel free. Let's get some time on the phone.
Okay.
But this is a great introduction, and if anybody here right now actually has some quick advice they can leave you or share with you right now, that would be great.
Yes, thank you. Sorry, my camera doesn't work right now. I'm getting in.
That's no problem. Any of the panelists want to comment on Julie's situation?
Yeah, Julie, I truly sympathize with that. It's really terrible when we're still not recognized. And if you think like if you from the US, people often think that you're very much advanced in this field, but it seems like everywhere, high, low to low income countries, we're still running into these issues of paternalism and not really having people with lived experience leading these roles and really fulfilling what it's defined as. But I do think the best, I think Laura is in a perfect position to help guide you on this.
Yeah, I think so too. Thank you.
Yeah.
Yeah, I definitely agree. I think Laura is definitely the person to reach out to. So thank you, Julie. Thank you for your for sharing that. And I would like to go to Glenn, please.
Yes, the mic, Glenn.
Glenn, you're on mute.
You're mute, yeah. You need to unmute.
Oh, okay, having
with the
issues
idea.
with audio. Okay, all right,
Oh,
let's
yeah.
go to
I think
Melody.
he's on already. Glenn, you can try. It's already on.
Okay, I think we can revert back to you, Glenn. Let's go to Melody. Hopefully your audio issues have worked out. Right, Melody?
Hi. So I was kind of going back to Laura's question as to whether anybody is working on advocacy at this time. And I did want to say I'm involved with an organization, WSCC, Laura. And in August, we are doing a parent weekend. And one thing that we're going to be working on is teaching the parents how to advocate for their children who have mental health conditions. And so I'm pretty excited about that. We just had a meeting last night, just talking about what kind of workshops we're going to offer and how to really, teach them to feel confident in themselves and then be able to feel confident in advocating, not just, in the schools, but in medical health or during transitional age when these kids are going from, high school to adulthood and they still need care. And then also, advocating at a legislative level. And this is one reason I reached out to Laura a couple of years ago, because I was interested in learning more. Unfortunately, I haven't been able to spend as much time as I would like, but I am grateful to be here today. Thank you, everyone.
Thank you, Melody. Laura, I'm not sure if you'd like to add your input.
No, I just think it's great that you're here, Melody, and WSCC is Washington State Community Connectors, and they are cutting across various sectors, which is really important. There are a lot of individual organizations here in the state where we both live. It's astounding. When I moved back here, I was away in Oregon for quite some time and then came back, and I was just astounded at how many individual groups there are, but sometimes they don't work together. I think they're starting to work together a little bit more closely now, mostly because funding is actually, or some of the funding sources are requiring it. Bringing people together is like considered an asset, which I completely agree with. So more of that's going to actually help inform our system. But thank you for being here, Melody, and anything that the Global Mental Health Peer Network, by the way, has a great website with a lot of resources, YouTube videos, and so on. So if any of that might be helpful as you start to get involved locally or statewide, there are some great resources there. Putting the website address in chat. I just put it in chat.
And thank you for sharing the info about this meeting, so I could be here.
Yeah, absolutely.
Excellent. Thank you, Melody. Glenn, it seems to be still having mic issues. Glenn, I'm not sure if you want to pop your question or comment in the chat. That might be best. Or
what I'm checking for Glenn is actually it has nothing to do with the mute system. It could be a problem on your side, Glenn, with the audio issues. Yeah.
Okay, I think the solution, Glenn, if you don't mind, if you can just pop it into chat. Unfortunately, we have to go to plan B. I'm just scanning over the chat box. I see we have had some really wonderful comments coming in, and it's really nice to see some beautiful validation and affirmation for our panelists for the work that you have done and continue to do. I read these comments, and I'm quite a sensitive soul. And it makes me feel all warm and fuzzy for the panelists and for mental health and the future of mental health. You know, from a very hopeful and inspiring, obviously, point of view that we are here to affect change and we will. I think there was a comment at the end that is more of a question, if I'm correct. Okay, so Kirsten has said that she's unable to use audio right now, but she's looking to get involved in mental health advocacy as someone who has a recent traumatic experience with a mental health professional. My experience shed light on unethical treatments and unfortunately how common it is in the field. I'm not sure how to get involved. So Kirsten, I would suggest you have a look at the GMHPN website. We are currently running applications, so you are more than welcome to apply. We obviously are a lived experience organization, so we could be an outlet or you know, that sense of belonging that has come through so strongly through this webinar. Right, Glenn, great job. If anyone would like to reach out to me for new national mental health peer organization, it's info@mentalhealthfoundation.com. Sorry, I'm battling to see the end of that, or email glenn@stigmazero.com. I can offer a lot of support and expertise. All right, so that's Glenn also reaching out and sharing his support for anyone that's looking for resources or assistance. All right, excellent. So I think before we go, I know Claudia wanted to say something, but didn't you, Claudia?
Always want to say something.
I know.
I think all I really wanted to say was, okay, well, two things. So thank you to our panelists. It's always nice to hear the different stories and how we can create new organizations or create new forms of supports, and, you know, just in different ways. It doesn't have to all look the same. And that's the power of it being individualized to some degree. But the thing that stood out the most for me was that each one of the panelists, when you were describing what you went through, your experience and how you had to change and be flexible and so on in order to get to where you are, you did not change yourself. So you remain true to your values and yourself, and you didn't become somebody else for someone else. You stay true to you. And having worked alongside Charlene, building up the GMHPN, that's something that I know has happened on our side, where there's challenges and you want to make everybody feel, you know, like you kind of want everyone to see you in the same light. And sometimes there's just people that don't fit for your organization and what you're doing, and that's also okay. So don't be despondent about that if you do find that not everybody's a fit. Just remain true to your values and who you are, and your organization will succeed. That's just kind of what I wanted to say.
Thanks, Clyde. It's also very powerful. I see Anto has his hand up, so let's Anto.
Thank you. So first, I would like to respond on what Melody stated, because I think she mentioned about teaching the parents about how to advocate themselves. So I think to make them build, I think building their own confidence is really important. That's why we need to encourage one to not each other, that to build the supportive environment, and of course, what I mean to build confidence means if you have the adequate and correct and right information about the condition and how to reach the recovery, how to speak what your needs to the stakeholder, for example. I think that's what we need to provide support on that. So building confidence and a feeling of comfortable it takes time, it takes trust. So it means you have to build a support. I mean, these fellow mothers or parents, to build a community for them, to make them to empower themselves. And the second is about the Glenn, about his mentioning about want to advocate about the issue that he stated about the treatment traumatic experience with mental health professional. I think this I have a story when Charlene and I met in WPA, the Congress of Psychiatric Association in Vienna last year, I think. So I met with a lot of story. I mean, the story of a lecturer, I think, from Australia who had a son that died because of the mental health service in Japan, and this person died, and she used this story to advocate. I mean, she wrote it in a story in a journal or something, or publications, and then she got very intense involving to the level of advocacy. This is in international advocacy that used by professional within the psychiatrists. I think, Charlene, is it possible for us to be connected to this level of advocacy, and how to go to that level? I mean, there are a lot of story in our network that worth to share. I think it worth to make a panelist in one of these congress, and we propose to be funded or even to be sponsored by them, or something like that way. So this is my idea. Thank you very much. I think that's what I can say.
Maybe to add, yes, I'm thinking, Antu, next year we're organizing the 7th Global Mental Health Summit in Cape Town, South Africa. Maybe that's the perfect opportunity to do exactly that. But yeah, let's talk about that and see how we can present these real life stories and use it as a vehicle for advocating. Yeah, I just want to say final word. Just one thing that which is always important for me, is when you think of an organization, it's not like about me. It's not me who made it a success. It's not, I didn't do it by myself. The organization, or any organization, would not exist without its staff or its members. So yeah, so I just want to say thank you so much for my wonderful staff, who's all here actually, and also our members, but also our supporters and followers, the rest of you people who joined today. So thank you so much.
Thanks, Charlene. Much appreciated. And to all our panelists and to everybody who attended today, it was a highly engaging session, very informative. I'm assuming all of you learned as I did. As I said at the beginning, these are 3 of the most experienced of our advocates within the GMHP, and it was truly my honor to host them. So thank you for the time, everyone, and for the patience. We've gone over a little bit longer than we usually do, but it's very much appreciated. So from my side, thanks very much, and take care, and hope to see you along the way. Right. Bye, everyone.
Thank you, everyone. Bye. Thanks, Sandra, as well.